Hello, my name is Jana, and I'm a registered nurse in the Calgary Pelvic Floor Clinic. This video is about using pessaries for pelvic organ prolapse and stress incontinence. This video will help you to do the following. Understand how and why you may need a pessary and how a pessary works. Know about different types of pessaries. Learn about issues you may have when you use a pessary and how to manage them. A pessary is a medical device that sits inside your vagina. It works by holding up your pelvic organs, like your bladder, rectum, uterus, and the top of your vagina. Pessaries have been used for centuries, and they are still a good option today. Let's quickly review what happens with pelvic organ prolapse. Pelvic organ prolapse occurs when the muscles of the pelvic floor have difficulty supporting the weight of the pelvic organs. Pelvic organ prolapse affects up to half of all people with vaginas. Prolapse can be mild to severe. The front wall of the vagina, with the bladder behind it, may prolapse down towards the vagina, which is the most common type of prolapse. The uterus can come down from on top, or if you have had a hysterectomy, the top or vault of the vagina itself can still come down. The back wall can also prolapse forwards. It is normal to have some movement in the vagina after having children, but prolapse can happen and cause distressing symptoms. With stress incontinence, pressure or stress on the bladder causes you to leak pee when you don't want to. It can happen when you do things such as cough, sneeze, run, or jump. A pessary can support your urethra to stay closed with pressure. Pessaries provide support and help hold up what was sagging down into the vagina, or sometimes even coming outside through the vaginal opening. The pessary sits inside the vagina to hold up prolapse of either the bladder, rectum, uterus, or top of the vagina. If the pessary is the right fit, it is comfortable and you cannot feel it once it's in place. You will always feel the removal and insertion of a pessary, but it is usually not painful. Here are some common types of pessaries for organ prolapse. You can see that there are different shapes. During a fitting, a registered nurse will help to determine which shape and style will work best for your type of prolapse. The nurse will also try to understand about your life and daily activities, so the pessary won't interfere with what is important to you. Ring and cube pessaries are most often used for pelvic organ prolapse. Here are some common types of pessaries used for incontinence. A knob on one edge supports the bladder base. Again, there are many styles and sizes. The nurse will help you to determine which will work best for you. The Pelvic Floor Clinic buys pessaries from different vendors. You will pay the same for a pessary as the clinic pays. The clinic does not make any profit from pessaries. The nurses work hard to try to get the best fit, but you may need to buy more than one pessary until you get the one that works best for you. Alberta Health Services does not cover the cost of a pessary, much like it does not cover the cost of some splints, crutches, or other supportive devices. The cost is only the cost of the pessary itself. There is no charge to you for the fitting and support you will receive. Speak to your nurse if you feel you cannot afford the pessary. There are no refunds or exchanges on your pessary once you take it home. You can check with your health insurance provider to see if they cover the cost of the pessary. Please note that the Pelvic Floor Clinic does not accept cash for payment. Here's an example of what one type of pessary looks like when it is inserted. If the pessary is the right fit, it is comfortable and you cannot feel it once it's in place. You will always feel the pessary when you remove and insert it, but it is usually not painful. Nurses at the Pelvic Floor Clinic are experts in fitting pessaries. The nurse will examine your vagina and recommend a few styles and sizes that may work for you. When you're getting fitted for a pessary, the nurse will ask you to cough, bear down, walk, and pee with a pessary inserted. You'll need to go home and wear the pessary for a while as you do your daily activities. 2 or 3 weeks after your fitting, a nurse will call you to find out how the pessary is working for you. The nurse will help you if you have any concerns. You may need to change the size or style of pessary. It's common to get more than one pessary if the first one isn't quite right for you. Let's look at how to insert and remove a pessary. Fold the pessary and apply a lubricant so it slips in easily. You can put the lubricant right on your vaginal opening or put it on the pessary, whichever works best for you. The pessary generally finds its own place. You'll need to use your finger to pull it out. You can do this standing, sitting, or lying down, or while you're on the toilet or in the shower. Any position works where you can reach inside your vagina and hook your finger over the pessary. You might attach a piece of waxed dental floss to the pessary and use that to pull it out. If you have long nails, you may prefer to wear gloves, but it is not necessary. Your nurse can help you find the position that works best for you and give you tips for removing your pessary. Pessaries are made of silicone, a soft material that is fine for most people. The material is very safe for protecting against infection. You need to remove your pessary from time to time to clean it and to give your vaginal tissues a break. How often you remove your pessary depends on many factors, including whether you can remove it yourself and how healthy your vaginal tissues are. Everyone is different. You may remove your pessary every night or choose to wear it only on certain days or for certain activities. If you are wearing your pessary full time, it's best to remove your pessary at least once a week. Some pessaries are simple to remove, and you can remove them yourself in a few seconds. Others take longer to remove, but you'll get better with practice. If you cannot insert or remove the pessary on your own, it will be arranged for you to have a nurse or doctor in your community look after it for you. As you get closer to and go through menopause, the lining of your vagina becomes thinner, more fragile, and it can be dry. The pessary can irritate your vaginal lining, which is why it is important to remove it from time to time and never forget that you're wearing it. When you wear a pessary, it's common to use a vaginal moisturizer or vaginal medicine regularly. These are available over the counter or by prescription. Vaginal moisturizer or medicine can help keep your tissues healthy and make sure the pessary isn't irritating. If your vagina is getting irritated, you may have a vaginal discharge that can cause an odor. Taking breaks from the pessary and using vaginal moisturizer or medicine regularly usually fixes the problem. You may be able to feel the pessary when you are about to have a bowel movement. That's because your rectum gets larger as it fills and pushes towards your vaginal area where the pessary sits. This usually goes away after the bowel movement. If it's a problem for you, you can remove your pessary before a bowel movement. Just remember not to strain and try not to get constipated because that could push the pessary out of position or even cause it to come out. If you are sexually active, you may or may not need to remove the pessary before you have sex. Your nurse will talk to you about this during your fitting. Pessaries are designed to last for many years, but they may become softer, slightly stained, or have a slight odor over time. Storing the pessary in dry baking soda when you are not wearing it can help. You may choose to replace it after a few years. Call the clinic and speak to a nurse if you feel your pessary is not working like it used to. Forgetting your pessary and leaving it in too long can cause problems and damage your vagina. If you develop memory issues, it is important that someone else knows you are using a pessary. Tell a family member that you have a pessary to help you remember. One advantage of pessaries is they don't cause any permanent change to your vagina. If you try a pessary and are happy with it, you may choose to use this as your long-term option. Sometimes people try a pessary while they are waiting to see a surgeon or for the right time in their life to have surgery. Sometimes people have had surgery and then they get symptoms of prolapse or incontinence again. If this happens to you, you can still try a pessary. You may even be able to stop wearing a pessary if you train your pelvic muscles to get stronger and you make other healthy lifestyle changes. Whatever you decide, your pelvic health team will help you to find what works for you. If you have any concerns about your pessary, contact the Calgary Pelvic Floor Clinic or your pelvic healthcare provider.